up to donate my organs. Those are some things, that's one reason that people won't want to donate, because they feel, okay, if I say I'm going to donate, they'll stop caring for me, you know. And so things like that, we're going to talk about that. Ms. Smith is going to share some nuggets about that with us tonight. I'm going to read something that I saw, and I hope that you would touch that also while you're talking, because I think it was the reason why I actually thought about this. So I saw something that this doctor wrote, Dr. Joel Mullen. She wrote an article online on the website of the Association of American Medical Colleges, dated 29th of November 2022, and it says this: in the United States, black people are 4 times as likely to develop kidney failure as white people, but they are much less likely to receive a life-saving kidney transplant. Black people also experience the highest rates of heart failure, but receive heart transplant at lower rates than their white counterparts. So again, we're going to be talking, I hope that you will talk about how you handle racial disparities when it comes to transplantation and things like that. So without wasting our time, I'm going to yield the microphone to Ms. Smith to kind of guide us through these things, and then we'll open to question and answer after Ms. King also will talk about advanced directive. So please put your hands together for Ms. Candice Smith.
Thank you. So my name is Candice Smith, and I am an education specialist with Lifelink of Georgia. And I think, is this for this? Okay. Is this here? Okay, there we go. That's fine. I actually know this by heart, so it's not. So Lifelink of Georgia is actually an organ procurement organization. That's short for we actually educate and make sure that we do coordinate organ recovery and organ transplantation. So my role specifically is to go out in the community and do education on organ procurement, organ transplantation. And I do that through mediums of churches, schools, public speaking, health fairs, things of that nature. What I'm doing now, just this. But the role is specifically special because in the African American community, as Pastor Arnold stated, we are undereducated specifically in this area because of myths, which I will touch on. You said something very specific about health disparities, and I'm going to touch on that because it's the fear that gets us to not want to donate. And the health disparities, what she wrote, I'm not saying it's wrong because she is a doctor, so she sees a different aspect, but some of that can be coupled with the blood type. Some of it can be coupled with because of health condition. So it may not necessarily be a disparity because they're black, but it may be because of health conditions. It may be because of, where they are with their medical condition. It may be because there aren't matches. And all of that goes with cultural, there aren't enough of us registered, because what it boils down to is 65% of the waiting list is made up of black people. We are the minority majority. So we are the minority in the United States when it comes to race, but we are the majority when it comes to the waiting list. That is a staggering number when you think about how, just think about it. We are told we are the minority race, but how is it that we're the minority race, but we're the majority when it comes to a waiting list? You said something else. You said, what did you say about kidney? The organ that is needed the most is kidney. And that's because most of us that need kidneys is because of end-stage renal failure. That's kidney failure. 90% of the time, by the time a person is end-stage renal failure, it's stage 3 or stage 4. Most of the time, doctors don't catch it before then, okay? And a lot of time that's because of genetics. It's because of diabetes. It's because of high blood pressure. It is because of, what else? What else can anyone think of? Those things. Any other things that we're genetically predisposed to? Drinking, poor diet, just a lot of the conditions that we have in Black communities. So it's not necessarily, like she said, disparities, but some of these things we're just predisposed to. So it's not necessarily the medical industry, but some of these are things that we may cause ourselves, or some things, again, it may be a genetic predisposition, or it may be a financial issue because we may not be able to afford healthy food, you know. So there are a lot of factors when it comes to what the doctor said. But the article, of course, you know, you write what you know, you know, so you write what you, or you write what you think you know, perception is reality, right? You know, so, and her perception is that there's a health disparity, and there is a health disparity. But when you delve in deeper, what causes that disparity? What, you know, okay, there is if you look at the Black community, there is a dialysis clinic on every corner. You know, so again, you look at these things, and so that's like my role. When I first started at LifeLink, I said, hey, I really wanted to find out like a lot of stuff about my role, because I figured you're gonna have to answer a lot of questions about different things. I looked at, there is a dialysis clinic within about a mile radius of Black communities, because a lot of Black people are going to these places because a lot of us have issues with our kidneys. And a lot of us don't even understand what the function of the kidney is. A lot of us don't understand what our bodies do. And a lot of us don't understand what kidney failure is. A lot of us don't understand that there are people in our family that go to dialysis. A lot of us know people that go to dialysis. A lot of us know people that have gotten kidney transplants. A lot of us know people in our families that have high blood pressure and don't understand what that's doing to them. We don't talk about health. We don't talk about Big Mama passing from diabetes, or Big Mama got amputated, you know. So it's just those things, like, when you really get into it, we really don't talk about, like, from beginning to end, how we can prevent, being on the waiting list, how we can have a healthy lifestyle and have organ health, because it can be little things. So I'm gonna get into the presentation, but the stuff that I've said is already in the presentation. I know the presentation back and forth. The presentation is really just for you guys, more so. So there are 56 OPOs in the United States. And OPOs, again, is what LifeLink is. And the OPOs basically, again, facilitate the organ transplantation process. And they're governed by CMS, which is an actual, you guys are familiar with CMS. They're a medical institution with the United States. And LifeLink actually services 159 counties in Georgia. I service, right. So there's LifeLink of Georgia, there's LifeLink of Tampa, and there's LifeLink of Puerto Rico. Now, I want to go to Puerto Rico. Haven't been yet. But I actually service the Metro Atlanta area. And if you are from Atlanta, you know that Metro Atlanta is not just Atlanta. That's where Clayton County, DeKalb County, Gwinnett County, yeah. But I also have a counterpart that services the Latino community, and he services the same, but he just services the Latino community. So we actually service a great part of Atlanta. Sorry about that, guys. All right, so this is our mission. again, know it backwards and forwards. So we've already touched on this, but this is for your benefit. Our mission and my mission. So let's just kind of get into it. This is what I talked about, and this is how you know what I said is true because it's written here. I want you to really think about things like when we go to the doctor or when we don't go to the doctor. Going to the doctor is so important. It's so important that it's so important. Like, it's so important that you need to go twice a year. Like, they say once a year, but you really should go twice a year. And the reason why is people say, like, oh, I don't want to know, but you want to know. You know, and the reason why you want to know is so that you don't have this. And what I just found out from a friend of mine that is a physician, she's finding that these things, high blood pressure, diabetes, and high cholesterol, are actually showing up in younger people. So you don't have to be 50 to be diagnosed with these. It's happening in 30s and 20s. She had a patient that had a heart attack, and he was 27. Yeah, this stuff is happening, like, early now. So it's not old people. I'm 50. It's not happening. You ain't got to be 50 no more. It's like this happening at 20s and 30s. And it's not to scare you, young people, but it's to let you know, be aware of your health. Being aware of your health, it should not be a frightening thing. You want to know because you want to live long. You just said you can't. You do have to die to get into heaven, but you want to prevent that as long as you can. You want to enjoy God wants us to enjoy our life. You want to live the promise, okay? What's the promise? 70 years, right? Okay. At least. Okay, anything after that is a bonus, right, Rev? Okay, but I want 70. I want the promise. And then anything after that, I want the bonus. But I definitely at least want the 70. So these numbers, and this is as of August 14th, we get these numbers. These are statistics. Remember those statistics I told you about, those staggering numbers? I told you I know my job, right? My job. 65% of that. So this is the waiting list numbers, and this is actually kidney because that's the most needed organ. Remember I told you guys about that, right? Okay, so the most needed organ in the United States is kidney because end-stage renal failure. 104,000 people in the United States need kidneys. They're waiting, okay? 104,000 people are waiting on the waiting list. 89,000 of those people are waiting for kidneys. That's a lot, guys. Okay, so then we drill down to Georgia because that's where we are. So that's important. That's important to us. Not that those 104 people aren't, but Georgia. So in Georgia, 2,968 people are just on the waiting list alone. They're waiting for livers and hearts and all of those organs, okay? Life-saving organs. Remember, I'm going to touch on this, but we got eight of them in our body. Now, of that, 2,500, I might as well say 2,600, okay? So that's almost every person. That's almost every person on that list. Wait a minute, no. Who said wow? Wow, okay, I'm about to blow your mind. 65% of those people are black. 65% are black. That's crazy. Okay, so we do have some good numbers, okay? So, numbers of transplant performed. Now, these numbers are a little bit older because of how they go through CMS. So we don't have the 2024. We get these numbers 2 years at a time, and I think you guys are familiar with this and why, because we have to make sure they're as accurate as possible. And so this is 2022 and 2023. They are. I'm sorry. It's the government. It's the government. So but at least we get them. So these numbers are for 2023 and 2022. But we do see an increase. Now, during COVID, these were lower, but so after COVID, we did see a really good incline, okay? But they can be better, and the reason why they can be better is because, again, we can register to be organ donors. We're not saying we need people to register to be organ donors. We need us to be registered organ donors. And I'm going to get into why. But if we had more registered organ donors, we could recover more organs. We could save more lives. We could see the number of transplanted increase. We could see the number of donors increase. And guess what else we could see? We could see the waiting list numbers decrease. And we could see the Georgia numbers decrease. And we could see the African American numbers decrease. So that would make me smile. And it would make you not say, wow. It would make me not say, wow. All right, I saw this on your, but I saw it on your email. You said, so who has this on their license? Miss TK, Rev? Nobody else? So I'm gonna say these two are superheroes because they are lifesavers, and thank you so much. And I have it on my license. So I've been a registered organ donor since I was 16 years old, and I made a joke. I did it because at the time, they said you can get $5 off. Listen, I was 16, but I didn't realize how important it was. At 16, you just want to save money, guys, okay? I was happy to be driving, but at 18, I had a friend that needed a kidney, and she got it. But, and the story goes, she needed a kidney, her cousin was a match, she was a living donor. And I was talking to my mom, and I was like, oh, my mom was like, I don't know if, I was 18, my mom was like, no, basically, But I said, but it's on my license. My mom was like, that's if you die. I was 18. And so the conversation the conversation became relevant then. So and so I said, okay, so this is if I die. And my mom's like, yeah, this is if you die. This is only going to happen if you die. I said, okay. She said, are you still okay with this? I said, I am, because again, 18, you think you're invincible, you're young, right? I said, because if I died, I don't need it, And she's like, okay. Now, my mom didn't battle me on this because mom is just really cool. And I never thought about it again, so it's still on my license, I say that to say my reasoning changed. It was in front of me, At 16, I was happy to get a license, and I was happy to save money. Because my mom was like, if you get a license, you're paying for it yourself. She didn't want me to drive. So it's like, oh. At 18, my friend needed a kidney, and her cousin, she got a living donor. But then I was exposed to the dynamic of organ transplant. And years later, I was exposed to it again because another friend needed a kidney. Yeah, and then years later, I was exposed to it again, probably about 30 years later, probably about 20 years later, because my best friend, who is also a pastor, he needed a heart transplant. I worked with him elbow to elbow. We worked in the mayor's office, and he didn't tell me that he needed a heart transplant because he didn't want me to lighten his load. And he put me on the call list. And I got the call, and he told me 2 days before, he was like, I need a heart transplant, and you're on the list. They're going to call you if I have to go into the hospital. And I'm like, what? But they called me when they were about to take him in. So he got a call a year after he went on a waiting list. So he got a heart transplant a year later after being on the waiting list. He has 5 years now with his heart. I've been exposed to another, yes, that's a blessing. Thank you. I have another friend whose mother, she got a kidney transplant about 2 years ago. I know, right? I might be bad luck, guys. She got a kidney transplant about 2 years ago. Now this is a very, very, very spectacular story. She actually gave one of her kidneys to her sister 30 years ago. She got a kidney transplant about 2 years ago. So she gave life and received life. What a blessing. So that's like my why more so than anything. To educate, to see the legacy of life be given over and over and over and over again, and to just understand. I know in our community we have seen the health industry disparage us in so many ways. I'm not stupid, and I don't run from the conversation. I know that there have been instances where there's distrust, and it's the fact that we can have the conversation. I answer the question. So if you have questions, that's fine, but don't leave the conversations with those questions, because the thing about it is, if you do, then you're going to continue to perpetuate that cycle. And what happens is you just will remain uneducated. And you never know if you're going to end up being that person that needs an organ or somebody in your family. And then it's like, I can't tell you, and this is no lie, I cannot tell you how many people, you would be amazed how many people say, I wish my such and such needed an organ transplant, and I wish somebody would have helped them. I promise you not. It is more common than you think. Because, remember that list. It's more common than you think. And I would have never thought that it was common, but those numbers prove, right? Statistics are our number one proof. So when I hear it, like I hear people say it all the time, I wish that, such and such would have signed up to be an organ donor because my grandmother needed it, or I wish that we would have known. Like, and it's people that actually that are on the waiting list, they family don't even know. Like, I talked to a young lady, she just found out her mom is on the waiting list, her mom needs a kidney. I said, well, none of y'all been tested? Her mom didn't want them to know. So now they're going through the process. Like her children, she has 4 children. If anybody's a match, it's probably one of them. But we don't talk about it. So, and these are kids, like they're young, so they probably are a match. And her mom's been going through dialysis for 2 years. I'm like, what did you think your mom was doing in dialysis? But again, undereducated. Dialysis cleans your blood because that's what your kidneys do. So people don't understand. It's like that's what your kidneys do. Like that's why they're going. She said her mom goes to dialysis 3 times a week, and y'all know that's taxing on your body. So she takes her mom to dialysis. So when she told me that, I said, do you ever go in dialysis with your mom? She was like, no, my mom won't let me. I'm like, I'm not trying to tell you what to do. She just she came to my table and she just broke down and started telling me. I'm like, you just need to talk to your mom because that process is not, trust me. I went to chemo with my brother, so I know dialysis is just as bad as chemo. That process is just as taxing. I'm like, you need to talk to your mom. And you guys probably want to talk to your mom about being able to, get tested because that's taxing, and you probably could save your mom's life. Like, you want your mom here longer. You want your family member here, right? So, yeah, I know I'm kind of getting into, this is important, guys. So, yeah, lifesavers, superheroes. All right, so remember those 8 organs? One person can save up to 8 lives, but there's other stuff. So, some people say, well, I don't really want my organs taken, even though you're not going to need them because you're going to such a great place. You don't need that stuff. You don't need it. But one person can enhance up to 75 lives because it's organ, eye, and tissue donation, okay? So I shared this with Ms. TK. My cousin passed, and they couldn't recover his organs because he was really ill, and his organs were not good. But they recovered his eyes. And, They recovered his eyes. And so I had to kind of walk my family through that because they were not feeling it. And I'm like, look, he authorized it, and that's kind of how that goes. And once they understood, like, it was, they were okay with it, but that's huge because it was his legacy, and he lives on in someone else. So this is pretty much what can be recovered. Um, it's great because think about what science is doing now. This is how we can bless people. So when you think about, you have 2 kidneys, so that's how you end up with the 8 life-saving organs. And this is where we get into the myths, and I'm not going to delve so far into the myths, but when people say, oh, they can, when they look at your license, remember that big picture, and, oh, they're going to get you on the side of the road and take your organs out, and do what with them? Remember, there's a whole process. They have to match your organs, your blood, everything, and it's a process. They can't do all of that in 4 hours. They gotta find somebody to make, so this is why you want to make sure that you're not falling into that trap of first of all, who is they, but don't fall into the trap. Don't fall into the myths. I actually left some literature on the chairs for you guys, but just don't ever let somebody tell you they are going to do something to you. No one is doing that. It's virtually impossible because this is the timeline. The first responders are only looking at your ID to identify you so they can contact your loved ones and let them know where you are and what has happened. Anything outside of that, nothing else is happening. And this is basically the factors. So when we talked about the doctor that wrote the health disparities, these are the things that go along with that. So it could be an issue with the organs. It could be an issue with the patients. It could be an issue with the blood. So her article was very vague she didn't really drill down into.
Some of the things out, not the whole article.
Yeah, so it was kind of vague, and I say that because good article, but it leaves a lot to be said. We do know that there are health disparities, but a lot of times what people don't understand is that there are so many reasons why people don't get organs, and a lot of times race is like the last reason. It is typically the last reason. It's a lot of black people walking around with white organs. Probably more than you think. Remember those people that I told you about? My friend got a white heart. He's still black though. And the other lady, she got a white kidney. So it's not, I'm actually going to be facilitating something soon called organ transplantation and donation is colorblind, because it really truly is. The things that can prevent you from getting organs, the last thing is race. We say that we need more black people to be registered because it is a better chance of less rejection and match with cultural matches, because most of the time we typically have the same blood match and things of that nature, genetic match. So that's why we encourage more African Americans to register. We're not saying that you won't get a transplant if there's a white person organ. There is cross-race organ transplantation all the time. But there's a better chance of longevity. There's another they will allow.